So brains actually shrink with age. It's subtle, but it starts even as early as in your 20s. And the reason people's brains are shrinking is that they lose neurons in specific areas and also lose connections between neurons. And the rate at which that happens and which specific area that it happens in tells you how much you're at risk for certain disorders. So if you see accelerated shrinking of your hippocampus, that would put you at risk for Alzheimer's. If you saw accelerated shrinking in the frontotemporal regions, that would put you at higher risk for frontotemporal dementia, for instance. And we also see other things on MRI. So we can, a big part of whether or not you end up with dementia is how you're doing with your cardiovascular health in your brain. So the blood vessels in your brain. So we can see things like white matter hyperintensities, which are these little cardiovascular changes that occur in the brain. They are very common with aging. Most people have them, but they're not benign. So they do put you at higher risk for stroke or vascular dementia. And they're at least partially reversible with better cardiovascular control. So you can track them over time, see that you're having them reversed or slow down the progression of them. And, the way to do that is through better cardiovascular control with blood pressure and cholesterol and lipids and all the same ways you take care of your heart.